communication between the doctor and yourself. Now, communication skill is different for everybody, all right? You'll find that scientists, for overall, whether they are out there doing chemistry in the lab, or whether they do, journalists who are on the street visiting people and communicating with other people, that level of communication is very different. And comedians on TV are much more talkative. And everything is so lively and makes you laugh and cry and all that. So communication is very important for the individual, because if you feel that every time you go in and see a doctor, you are so tense, your blood pressure goes up the roof. Not a good thing. But on the other hand, it's very normal. For instance, to see a dentist and your blood pressure is high because you worry about getting drilled. Okay, and going to see a doctor for the first time, likewise. They call it the white coat syndrome, which is in itself a story, many stories to tell. So communication is, you walk in a room and is chemistry good? Do you like that person? It's not like a first date that you are going for different things. You look for different things. But for a doctor, I think a lot of times one visit may not be enough to find out what's going on. And I find a lot of patients actually come in just to want to sit down and talk because they're selecting a doctor. And that may not be the case for you. Sometimes I grant that depending on my availability, and especially when the parents are having a newborn baby, and they want to interview for their newborn child. So communication, on the other hand, also in this day and age, is in San Francisco anyway, is we have so many different languages, so many different backgrounds and culture. How does one communicate when you're monolingual in Korean, Japanese, Asian background, or instead of say European background, which is a lot closer to the United States? So that is a huge concern, because even if you know that doctor is a great doctor, you hear from your friends, all great recommendation, but they don't speak your language, so every time you go, you gotta have XYZ with you. It may be your grandson, or your best friend, or your brother or sister. Now, of course, it's good in some ways that you have somebody who's trustworthy to come with you, but at the same time, there's also that confidentiality question. Do you want to have this person know everything about you during that visit? So sometimes it's good to have individual communication directly with the doctor instead of through a translator, for instance. So I think if the doctor speaks many languages, of course, great. That's the way to do it. But it is different to try to explain to I'm talking about my experience now. It's different to talk to a patient on a day-to-day level versus you have a problem with your intestine or your heart that is difficult to explain with ordinary languages. You might have to have a diagram, you might have to have a certain level of chemistry that you have to understand. For people with high cholesterol, what is the number of 300 high cholesterol? What does that mean? What is a good and bad cholesterol? For people who don't have any background in science, it's tough. Now, I can explain till my mouth is dry, but if that person don't understand you, then the communication gap is much wider. And for that reason, I think it's good to have somebody who can explain it to you at the level you understand. So going to a professor at a university who is terrific, leader of the world in that topic, and but you don't understand a word he said, because to you it's all Greek. then it doesn't work for you. Okay, so communication is very important. And also, don't go to a doctor that tells you, well, why don't you go and see your primary care? I'm done with you. And just turf it off, because that wouldn't be a good thing. Because if that person took care of you with that problem and you still don't understand what's going on, you don't want to have your primary care trying to explain something that he or she was not involved with to start with. Okay, so I think that's a difference between sometimes academic doctors who does research and they don't have the time to sit down with you and explain the ABCs of what happened. And usually they defer that to some junior doctor to try and explain those things to you. And unfortunately, that's a price to pay if you go very high up in the ladder of academic to seek out the quality of doctor.